Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. A new study published in Advances in Nutrition by researchers from Brigham Young University and Germany reveals a stark connection between sugary drinks and type 2 diabetes. Just one 12-ounce sugary beverage per day can increase your risk of developing type 2 diabetes by 25%. Even fruit juices aren't off the hook. An 8-ounce serving raised the risk by 5%. The study found no safe threshold for these drinks. In contrast, sugars from solid foods may have neutral or even protective effects. The message is clear. Even one sugary drink a day can significantly impact long-term metabolic health. Maternal mental health in the U.S. is facing a worsening crisis, according to a new study in JAMA Internal Medicine. From 2016 to 2023, the percentage of mothers reporting excellent mental health dropped from 38.4% to 25.8%. The steepest declines were observed among single mothers and low-income households. Physical health declined as well, though less sharply than mental health. Contributing factors include reduced access to care, financial stress, isolation, and societal pressures. The study calls for urgent intervention to support maternal well-being. Climate change is not just raising sea levels, it's also spreading deadly fungal infections. Research from the University of Manchester warns that warming temperatures will dramatically expand the reach of Aspergillus fungi across Europe. By 2100, nearly 9 million more Europeans could be exposed to aspergillosis. Fungal infections already claim 2.5 million lives annually, yet remain underfunded and understudied. Climate-driven extreme weather and drug resistance are accelerating spore dispersion, emphasizing the need for better surveillance and research funding. Sleep disorders could signal the onset of neurodegenerative diseases years before symptoms appear. A large multinational study published in MPJ Dementia finds that diagnosed sleep disturbances can predict Alzheimer's and Parkinson's disease up to 15 years early. Even those considered low risk showed significantly higher dementia risk when sleep disorders were present. Insomnia, nightmares, and sleep apnea were key predictors. These findings reinforce the importance of early sleep treatment as a preventative measure for cognitive decline. At the World Health Assembly's 78th session, the World Health Organization revealed that antimicrobial resistance caused 4.71 million deaths in 2021. In response, a revised global action plan aims to reduce bacterial AMR deaths by 10% by 2030. The strategy will be finalized by 2026 and follows a One Health approach, integrating human, animal, and environmental health. Focus areas include improving global surveillance, ensuring equitable access to antibiotics, fostering innovation, and enhancing accountability across systems. A new study from UCSF published in JAMA Cardiology reveals that marijuana use may carry hidden cardiovascular risks. Users of THC, whether through smoking or edibles, showed impaired artery function, pure scent for smokers, and 4.6% for edible users. In contrast, non-users exhibited a significantly healthier vascular response at 10.4%. The study found that cannabis smoke affects blood vessels similarly to tobacco. As marijuana legalization continues, researchers caution against overlooking its cardiovascular impact. Finally, researchers at Tufts University have developed an innovative form of dental floss that can detect stress in real time. Published in ACS, Applied Materials and Interfaces, this floss analyzes cortisol levels in saliva with lab-grade accuracy. It's designed for home use and may eventually track other biomarkers like glucose, estrogen, or cancer indicators. This technology offers a practical and non-invasive method for stress detection, paving the way for earlier intervention and better health monitoring. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com